Another contemporary issue in healthcare in general and in pharmacy in particular is personalized medicine. As we begin this discussion, I want you to think about the fact that medication usage in our country to a large extent is sort of a one-size-fits-all phenomenon versus customizing it for an individual patient. We have doses that are prepared by manufacturers in a particular dosage form. We have dosage guidelines that are provided for adults and perhaps children or infants as well. So it's sort of a population approach to medication therapy versus an individualized approach. So let's think about how we might change that into more of a customized approach to healthcare or personalized medicine. We used this pharmacy fundamental the very first week of our course, and if you'll remember, we defined personalized medicine as the individualization of a patient's therapy based on his or her unique characteristics using genetic and other available information. In this module, I want to build on that definition, and we're also going to bring in another term for your learning, and that's pharmacogenomics. So as we think about personalized medicine, I want you to think customization of medication therapy versus the one-size-fits-all phenomenon. I want us to think about taking proactive approaches to treatments versus reactive. You know, to a large extent in our healthcare system, we kind of wait for problems to come up before we make changes, or we dose to clinical response. If we think about personalized medicine, we can take more of a proactive approach, perhaps predict which drugs and which doses which would be better for this patient in this particular situation. We're going to use the term pharmacogenomics in this personalized medicine. I'm going to define that for you on the next slide. And the last point on this slide that I think is very interesting is a thing called three-dimensional drug printing. You see there the Journal of the American Pharmacists Association, May and April of 2013, had a series of articles on kind of future trends that are affecting our field, and 3D drug printing was one of them. I'm sure you're familiar with 3D printing, or at least heard about it. It's not a new phenomenon, but it's certainly a growing one. And if we take this idea of personalized medicine to the next step, not only knowing which drugs work best or which doses work best, but could we produce those drugs in a ready-made fashion, in an easy-to-prepare fashion using 3D printing that would give me the drug, the dose, maybe the combination of doses that are ideal for me. Has kind of an interesting and exciting possibilities. So what is pharmacogenomics? I want to define this for you as the study of how a person's genes affect the way he or she responds to drugs. Pharmacogenomics is being used to predict the best drug or the best dose of a drug for a particular patient. This was the definition provided by the National Institutes of Health. So we think about how do genes affect individual responses to medicines, and then how could we make changes in reaction to what we know about those genetic differences. We also, by the way, we're thinking about the use of genetics in practice. We certainly know that gene-based research could have a huge impact on drug discovery and drug development as well. So let's think about an example. Let's think about the drug warfarin or Coumadin. You've heard about this drug several times in the course of our studies in the last 7 weeks. I want you to think about Jaime Capistani once again, who runs an anticoagulation clinic where they dose patients using Coumadin. So this is an anticoagulation drug. It's used in the prevention of thrombotic diseases, which could be used to prevent things like stroke or heart attack, for example. It's hard to manage, has a narrow therapeutic index, meaning that if we give too much of the drug, that the patient might bleed more than they should, or if we give too little, they might have blood clots that would be harmful to the patient's health. It is among the top 10 causes of serious adverse drug events in the country. So it's a drug that's hard to dose and hard to treat patients with, but also has some serious consequences if it's not done right. So we know that there are variants in the gene encoding the enzyme that metabolizes this drug and vitamin K that, based on genetic differences between patients, could diminish the metabolism of the drug warfarin by as much as 90%. So you can see that if I have genetic differences that cause a diminution in terms of how the drug is metabolized, it could seriously affect the amount of the drug that remains in my body and could get us outside that narrow therapeutic index and get us into a bleeding situation or potentially a clotting situation. This situation with warfarin is well recognized to the extent that in 2007 the Food and Drug Administration required a special warning label on the product which points out the relationship between genotype and warfarin clearance. So it's codified into the labeling of the drug. And we even have commercially available testing to help us predict this and prevent it. So, there are many examples. Warfarin is probably a really good contemporary and commonly used one, but certainly more and more we're learning about genetic differences that change drug kind of effects and drug metabolism and help us to treat patients more individually or more customized versus one size fits all. Let's go through our pharmacy fundamental today, and we're going to expand on the definition of personalized medicine that we started in week 1, and then we'll also include pharmacogenomics to our fundamentals today. So let's add this to our thinking about personalized medicine. An emerging practice that uses an individual's genetic profile to guide decisions made in regard to the prevention, diagnosis, or treatment of disease. And here, for the first time, I'll have multiple slides to define this phrase. Let's go to the next one. Knowledge of a patient's genetic profile is used to select the proper medication therapy and administer it using the optimal dose or regimen. And finally, personalized medicine is being advanced through data from the Human Genome Project. And again, this is NIH definitions. And then we've defined pharmacogenomics as the study of how a person's genes affect the way he or she responds to drugs. Pharmacogenomics is being used to predict the best drug or the best dose of a drug for a particular patient. In our discussion forums this week, here's the question I want you to think about for this module. How will medication therapy change as personalized medicine becomes the standard in healthcare? So we think about how different things that we've studied this course will affect how pharmacists practice, but I want to think more broadly about how will medication therapy change? How will it change in our hospitals, in our clinics, and our outpatient settings? How will the way we use drugs fundamentally change based on what we know about pharmacogenomics and personalized medicine? I look forward to seeing you next time.